Good morning. We're here with another episode of 40 not 50. As you know, a government task force is telling women to start screening mammograms at age 50. We see so many young women under 50 with breast cancer. We think these recommendations could be a tragedy. With us today is Tracy, who has a personal experience with having breast cancer at an early age, and she's here to share her story with you. So Tracy, we go back a long time, don't we?
Yeah.
How did it all start?
When I was in my early 20s, I realized that I had fibroadenomas. So I was sent to you by my OBGYN. You did a biopsy on me when I was about 21. I've been a patient of yours ever since. And we followed this benign condition that I've had all these years.
Mm-hmm. Well, I'm sure glad that you stuck with it, because so often women with early onset breast problems, even when they're benign, kind of get a biopsy, it's benign, and then maybe you lose track of them, and then maybe 15, 20 years later you see them with a problem. But you really stuck with it. You did the breast self-exam.
Right.
How confident are you on breast self-exam?
Very confident. In fact, most of the fibroadenomas I've had over the years, in fact, all of them, I'd say, I found and brought to your attention. Mm-hmm. So, and that's all through self-breast exams and being really, aware of what's normal for me. Right. I also have very dense breasts and very lumpy breasts. Right. So breast exams have been challenging for every physician that's ever done them on me. But, I learned my normal, which really
That's what I remember about you, that you've always come in confident everything's either stable, you know it's bumpy, you know the pattern, and you're totally confident that I feel good about it, but I just want you to check. And so that's what we did. And then you got into your 30s, and finally, tell me when we finally did our first mammogram.
You started regular mammograms on me at 38, and then on a routine mammogram at 43, lo and behold, to my surprise, we found.
Were you shocked?
I was shocked.
Yeah.
Yeah.
How did you find out about that?
They found it right away. I mean, they found a calcification, and you've also done diagnostic mammograms on me. So, they'll do the mammogram, I wait, they review the film, and they almost always call me back, which never is a concern, because I know they're going to be looking at something that you've, an area you've already done a biopsy on, or an area you've put a plug in. And I really
tissue marker,
tissue markers. So I really thought, you're bringing me back for something like that, and it was calcifications that they had found.
Yeah. So the nice thing about our system is, when you come in, you get the mammogram, they do the extra views, they get the reading, and then you see the surgeon, which
immediately after,
immediately. So that eliminates a lot of the stress, I think.
Right.
It's very reassuring. But when you get a spot on there, you're going to need a biopsy.
Right.
Tell me about it. What happened when you learned that you had to have a biopsy?
Right. So they found it right away. I remember it was on a Friday, and they pulled me back in. I waited in the room. They pulled me back in for more films. I saw you, and you guys scheduled a biopsy for that Monday.
Good.
And I have to say, at that point, and knowing you for so long, I knew I was dealing with something different.
Was it a feeling of the way I approach it? Was it different, or did I? Because you try to be as neutral.
I knew with the urgency that I had to have that biopsy. I knew when you were sort of talking to me about, the odds it wouldn't be cancer. That I just had a feeling we're dealing with something different.
The odds actually with the cancers, the calcifications we biopsy, 4 out of 5 end up being benign. We try to we don't want to miss cancer, so to some extent we know we're overdoing it. And we've had criticism that we do too many biopsies, but the reality is so much more important to catch a cancer early than the downside of doing a negative biopsy, and you just don't know which are going to be which. So here you were 43 years old.
43. And with something I didn't find myself, it wasn't a palpable mass at all. Yeah. So really, in my case, the mammogram is what found it and allowed us to treat it when it was still
Did you ever treatable. Think about what might have happened, say, had you not been so diligent in your follow-up and not gotten your mammogram till age 50?
I don't think I would be here.
It really is a frightening thought. I mean, it could, in theory, be slow growing, and maybe you would have caught a lump early, and you're very good at self-exam. On the other hand, these things can divide and change, become more aggressive, and spread to other parts of your body. Once that's done, school's out. There's nothing we can do to reverse it. So being proactive, in your case, not only saved your life, but it saved your breast too.
Absolutely.
So tell us a little bit about the lumpectomy.
Right, so I had a lumpectomy about a month after the biopsy, and really an easy surgery, I have to say. Also a sentinel lymph node biopsy at that time. You guys took out 4 lymph nodes, and that was also very easy to recover from. But you know, it was a lot like the biopsies, the surgical biopsies I'd had in the past. So for me, very easy, you know, recovery.
One of the questions I do have to ask you, there's been a real trend for young women who have very favorable situations like yours to say, oh, I'll just take them both off. I don't want to worry. Did that thought ever cross your mind, or have you ever thought that maybe you could have done it differently, or what's your perspective?
I just couldn't wrap my head around a double mastectomy, I have to say. I mean, it's so major.
It seemed out of proportion to what you needed. I think we had a recent conference where they polled all the doctors, the male surgeons and all the female surgeons with a case much like yours, and the male surgeons, 99% said lumpectomy.
Right.
The female surgeons, surprisingly enough, also agreed with lumpectomy, but 25% bilateral mastectomy. I nearly fainted because it's just not necessary. The survival rate is exactly the same.
Right.
So it's just like it's over-treatment. On the other hand, when a young woman comes to us and after careful thought and consideration says that's what she wants done, I think we have to listen to her. We can't tell her she can't have it, but we try to educate them and say, look, I mean, you're the perfect example. Look at how well you've done. How was the radiation part of it?
Manageable, certainly, really not bad at all. And I didn't have to have chemo, so I was lucky in that respect. So
you're on now,
and now I'm on tamoxifen.
So tamoxifen is a hormone blocking pill, and your tumor was hormone positive, and so this gives you a major survival benefit to stay on it 5 years.
5 years.
And how are you doing with that?
I'm doing fine. It's tolerable. I mean, I do have some side effects, but they're manageable. They're the menopausal side effects that come with it. And, I'll be glad when I'm off of it, but I have to say it's not in any way debilitating me.
It is a major advantage. I think your case brings up just some incredibly important stories, particularly when we're talking about starting mammogram at 50. It just frightens me. I have so many patients, and you're helping with a lot of our patients. I know you're a phone volunteer at our center, and you see these young women. What goes through your mind when you talk to a young woman who's in her 40s, a mammogram finds a cancer, and you know that the government now has a committee saying you can wait till you're 50? I
think that's frightening. I mean, and again, just from my case, I know that, if I'd had a cancer if this cancer had gotten to a point of being palpable, I know it would have been advanced. Right. Because I had some aggressive prognostic markers in there, and we were really lucky to find it early.
That's a very important point, because some of these are going to be slow growing. Maybe it won't make a big difference. But if you have one with more aggressive characteristics, in a year or two, it could be a life or death kind of situation. We just can't afford. We've got to fight back on this thing. We'd like the viewers to take this story very seriously. There can't be a better example of a life saved with screening mammography, but not just a high quality life. The breast is saved. She looks virtually normal. She looks wonderful, symmetrical, and she's gone through it with, I'd say, a relatively easy course with the way you describe it. Yeah. So this is all very doable. Now is not the time to let our guard down. Now is the time to get aggressive, more aggressive. Start 40 for yearly mammogram for the average woman. High risk women, we need to get more aggressive, and there's more about that in our website. There's also other ways of detecting cancer that are sometimes missed on mammograms. So when we have women with dense breasts, we do extra screening like with the ultrasound or the MRI. So we're making incredible progress. Now is not the time to cut back. Now is the time to move forward. We need your support. See us on the web, join our campaign, learn what other women are saying, but make sure we fight back against this task force recommendation of starting at 50. Thank you. Thank you.
Thank you.